Hello, I am Dr. Rajita. Let's do a clinically very important topic, that is the venous drainage of lower limb, which is associated with the varicose veins of lower limb. So if you see the veins of lower limb, you can subdivide it as superficial veins and deep veins. Superficial group of veins are otherwise called subcutaneous veins and deep group of veins. And connection between these superficial veins and deep group are called as perforating veins. So superficial veins, here is the superficial veins, that is the safeness vein we can see. Small safeness vein, great safeness vein, and they are the superficial veins. And deep veins we can say anterior tibial veins, deep femoral veins, they are all the deep veins. And perforators or perforating veins or communicating veins, they meant to communicate between these superficial and deep veins. So the two major superficial veins are long saphenous and short saphenous vein. So the long saphenous is otherwise called as great saphenous vein, and this is the small saphenous. These two are considered as the chief superficial veins. And the deep veins are the which accompany the major arteries of the lower limb, and they have more number of valves comparatively to the superficial veins. So deep veins will have more number of valves than superficial veins. So superficial veins are more prone to varicosity. And stagnation of blood in deep veins result in DVT, deep vein thrombosis. So let's begin from lower to higher now. So starting with the plantar veins. So the plantar veins will start as plantar digital veins. We can see here dorsal and ventral plantar digital veins, which are called as dorsal digital veins and plantar digital veins. They connect and unite to form that is 4 plantar metatarsal veins. You can see here 4 plantar metatarsal veins, and these metatarsal veins, they connect with the dorsal veins by means of perforating veins, and these veins connect with each other and constitute a deep plantar venous arch. So they all connect to form a deep plantar venous arch, we can see here, and which continues laterally as the lateral plantar vein, and medially it continues as the medial plantar vein. And both lateral and medial plantar veins, they join to form posterior tibial vein, which accompanies along with the posterior tibial artery. So the veins connect with each other, which constitutes a deep plantar venous arch, and this adjacent to the deep plantar arch, this arch is present, and this venous arch, it continues to form medial and lateral plantar veins, which runs near along with the corresponding arteries, and they communicate along with the long and short saphenous veins before forming posterior tibial. So they communicate, medial plantar vein communicates with the long saphenous vein, and lateral plantar vein communicates with the short saphenous vein before terminating as posterior tibial veins, which accompany along with the posterior tibial arteries. So this is how they are formed. Finally, posterior tibial vein. Next, talking about anterior and posterior tibial veins and popliteal veins. So posterior tibial vein receives the vein from the calf muscles. So the posterior tibial vein is this one, which receives the vein from the calf muscles. So you can see the plantar veins continuing to form the posterior tibial vein here. So this is the posterior tibial vein. So it is mainly from the calf muscles, and especially the venous plexus of soleus, and connect with the superficial veins and also with the fibula, that is the lateral compartment veins. Next, about the anterior tibial vein. The anterior tibial vein, it is the continuation of vena comitatus of dorsal pedis artery. Vena comitatus means instead of a single vein, there will be two veins on each side of an artery called as vena comitatus. So dorsal pedis artery contains vena comitatus here, the two small veins. They continue to form the anterior tibial vein, which is represented in green color here. So this is the anterior tibial vein. So they ascend further superiorly and pass through the proximal end of interosseous membrane, and finally it unites with the posterior tibial vein to form popliteal vein. So this one is the popliteal vein. So the popliteal vein, if you see its formation, it is formed along the distal border of popliteus muscle, and beyond that it is called as popliteal vein. So that is about these three deep veins. Next, about the venous muscular pumps, that is muscular venous plexus, which are the components of muscle pump mechanism that communicates with the axillary running deep veins. So the axillary running, here are the deep veins with more number of valves, and these are the superficial veins. In between we can see the muscular venous plexus. So the venous return from the lower limb is assisted by this muscular activity. So when you contract the calf muscles, they will squeeze the venous sinuses which are located within the calf muscles, especially the soleus, which are the venous sinuses present within the soleus. So contraction of the calf muscles and foot muscles will cause the pumping of blood, and then perforating veins which connects the long saphenous vein with the deep veins, particularly they are present at the ankle and distal part of the calf and knee. So these things too, so here you can see these are the perforating veins. They are the perforating veins. So the venous return from the lower limb, it is assisted mainly by the muscular activity. So that is the reason the calf muscle, especially the soleus, is called as the peripheral heart of the human body, where the contraction of this calf muscle and foot muscle will cause the venous return. Perforating veins connects the long saphenous vein with the deep veins, especially at the site of ankle, distal part of the calf and knee region. So here we can see the tributaries of the femoral vein in the femoral triangle. So the long saphenous vein or the great saphenous vein is an important tributary, and we can see some veins which open at the junction where it opens into the femoral vein, that is superficial epigastric vein, superficial external pudendal vein and superficial circumflex iliac veins. So which drains into the femoral vein just at the opening of the saphenous vein. They run along with the superficial branches of femoral artery. And apart from that, so profunda femoris vein, this is the profunda which is called as deep femoral vein. That is the reason femoral vein sometimes called as superficial femoral vein. Don't get confused with that. Deep femoral vein or profunda femoris vein means the same, which goes to the posterior compartment to drain the blood from the hamstring compartment. That is about. And medial and lateral circumflex femoral veins which are present on each side. So this one is the medial circumflex femoral vein, and here is the lateral circumflex femoral veins which run from the medial, which drain the blood from the medial and lateral sides of the thigh. And there is a deep external pudendal vein also, which drains the blood from the perineal region. So these things should be noted. So there are usually 4 to 5 valves in the femoral vein. The two most common constant valve, one is at the entry of profunda femoris vein. So here at the junction of femoral and profunda femoris vein, and other is near the inguinal ligament where it continues as external iliac vein. These two valves are the most constant valves. Usually all together it contains around 4 to 5 valves, but these two valves are the most constant valves to remember. That was about the deep veins and perforators we will do again. So next we shall move on to superficial veins. Superficial veins, first we shall discuss about the long saphenous vein. So superficial long saphenous vein, it is embryologically considered as preaxial vein of lower limb. So developmentally it is the preaxial vein. It starts distally as the continuation of medial marginal vein of the foot. So dorsal venous arch and medial marginal vein, they both join to form, so we can see here, this is the medial end of the dorsal venous arch and this one is the medial marginal vein. They joins to form the long saphenous vein which goes like this and finally terminates at the saphenous opening at saphenofemoral junction. So it begins on the dorsum of the foot by the union of medial end of dorsal venous arch and medial marginal vein and runs upwards in front of the medial malleolus. That thing you have to remember, it runs in front of the medial malleolus. To be specific, 2.5 centimeters anterior to the medial malleolus, and it ascends on the medial side of the leg. It ascends along the medial side of the leg. It is along the posterior medial margin of the knee, lying a breadth of the subjects, and that is the breadth of hand to the posterior to the medial edge of the patella. And then it ascends on the medial aspect of the thigh and it passes through the saphenous opening, which is otherwise called fossa ovalis, where it drains into the femoral vein. It is accompanied by the saphenous nerve, which is a very important thing to be noted. It is accompanied by the saphenous nerve and it contains around 10 to 12 valves just before the vein piercing the cribriform fascia and saphenofemoral valve. We can see some tributaries opening into the femoral vein. So at the junction of saphenous vein and the femoral vein. So these tributaries are superficial external pudendal, superficial epigastric, superficial circumflex iliac veins. Let's see the tributaries of these great saphenous vein. At the ankle, the great saphenous vein drains the sole by the medial marginal veins. So we can see the medial marginal vein which is coming from the sole and also the dorsal venous arch, both of them join to form the great saphenous vein. And it is connected with the deep veins via the perforating veins in the leg region, and it also connects with the short saphenous vein also in the calf region. Then the main tributaries in the leg are anterior arch vein and posterior arch vein. And posterior arch vein collects the blood from the posterior medial aspect of the calf and begins at the series of small veins arches connecting these three medial ankle perforators. You can see here, here is the posterior arch vein. We can see medial ankle perforators. There are three medial ankle perforators which makes arcades, venous arcades or arches, and it connects the posterior tibial venae comitatus by a series of perforating communicating veins. So and the other vein is the anterior leg vein from the anterior compartment. Then here in the thigh, it receives the posterior medial and anterior lateral veins. So we can see here, this is the posterior medial vein, this one is the posterior medial vein, and here is the anterior lateral vein, which are the tributaries in the thigh. And as the great saphenous vein traverses the saphenous opening, we can see it is joined by the three veins, that is the superficial external pudendal, superficial epigastric and superficial circumflex iliac. But these three veins are considered as the tributaries of the femoral vein. And superficial external pudendal veins drains the part of scrotum in males and labia in females. And once it is joined by the superficial dorsal veins of penis or clitoris. And the last tributary of the great saphenous vein at the saphenous opening is the deep external pudendal vein, and which drains mainly the perineum. So that is about the venous drainage of great saphenous vein. So surface marking of the great saphenous vein is very important during venesection. At the ankle, you have to draw the great saphenous vein in front of the medial malleolus, means anterior to the medial malleolus, that is 2.5 centimeters anterior to the medial malleolus. It is present 2.5 centimeters anterior to the medial malleolus. Then at the ankle, it lies, in the leg, it ascends by crossing the medial surface of the medial border of the tibia. So we can see it crosses the medial surface. And at the knee, it is about hand breadth posterior to the medial margin of the patella. So one hand breadth posterior to the medial margin of the patella. So suppose if you say patella is here, from here to here is one hand breadth posterior to the medial margin of patella. In the thigh, it ascends obliquely. We can see it runs, it goes to the anterior side of the thigh, and it reaches saphenous opening. So the reaching point is 3.5 to 4 centimeters inferolateral to pubic tubercle. So here is the pubic tubercle. So the saphenous opening is here, which is 3.5 centimeters inferior and 3.5 centimeters lateral. You can say 3.5 to 4 centimeters inferolateral to pubic tubercle, where we can see saphenofemoral junction. So great saphenous vein anterior to the medial malleolus is the most preferred site to the venesection. So anterior to the medial malleolus, it is the most site for the common site for the venesection during emergency. So these things to be noted. So this part to be noted. So that was about the great saphenous vein. Next we shall move on to short or small saphenous vein. So short saphenous vein, it is the continuation from the lateral side of the dorsal venous arch. Medial side is the great saphenous vein. Short saphenous vein arises from the lateral side, where we can see the dorsal vein from the fifth digit and lateral end of the dorsal venous arch. They join to continue to form short saphenous vein. So then it is present on the lateral aspect of the foot, and inferior to the inferior and posterior to the lateral malleolus. Remember, great saphenous vein is anterior to the medial malleolus. Short saphenous vein is inferior and posterior to the lateral malleolus. These sites are very important, and it further ascends on the ascends superiorly in the lateral lower third of the calf, and where it is lateral to the tendocalcaneus. So here is the tendocalcaneus. This is the lateral side of the leg, and this is the medial side of the leg. So it is lateral to the tendocalcaneus tendon. So that is the location you can make near the ankle, and then it is accompanied by a nerve which is called as sural nerve. So it is always accompanied by the sural nerve on its lateral aspect, and it keeps ascending in the middle of the back of the leg, and it pierces the deep fascia, where it ascends a little further and reaches the middle of the popliteal fossa and to open into the popliteal vein. So finally it terminates in the popliteal. So this is the popliteal vein, where we can see it terminates in the popliteal vein approximately 3 to 7.5 centimeters above the knee joint. So the vein contains around 7 to 13 valves, and one those near the termination. So most constant valve you see near the termination of short saphenous vein into the popliteal vein. And let's do the summary of this venous drainage. So here is the schematic image to explain all the veins of the lower limb. So this line represents the inguinal ligament. So above to the inguinal ligament is the external iliac vein. This is the external iliac vein, and then below the inguinal ligament is the femoral vein. We can see the femoral vein here. And femoral vein, it is the continuation of popliteal vein till the adductor hiatus present within the adductor magnus. Above to the adductor magnus is the femoral vein. Below the adductor magnus in the popliteal fossa is the popliteal vein. And then popliteal vein, it is formed mainly by joining of anterior and posterior tibial veins. So this one is the anterior tibial vein, and this one is the posterior tibial vein. So this is the posterior tibial vein. Then lateral compartment veins are called peroneal veins. This is the peroneal vein. So how they are all drained into the popliteal vein. So these are the deep veins. Next we shall see the superficial veins. The long safeness vein we can see here, which is long from down. Then short safeness vein is on this side, lateral side, medially and posteriorly short long safeness vein, laterally and posteriorly medially and posteriorly long safeness vein, laterally and posteriorly short safeness vein. And we can see posterior arch vein, which is a tributary of long safeness vein. And we can see the lateral marginal vein and dorsal venous arch. They join to form the short safeness vein. Medial marginal vein, this is the medial marginal vein, which joins with the dorsal venous arch to form the long safeness vein. And let's see the perforators, some important perforators. So the mid-thigh perforator is called as Hunterian perforator. So Hunterian perforator is just above the knee joint, lower part of the adductor canal, where it connects the great saphenous vein with the femoral vein. So we can see it is the connection between the great saphenous vein and the femoral vein. So that is about the mid-thigh perforator or Hunterian perforator. Next about the knee perforator or Boyd's perforator, which lies just below the knee. So the great saphenous with the posterior tibial vein, it is connected. So this one is the Boyd's perforator. We can see it connects the great saphenous vein with the posterior tibial vein. This is the posterior tibial vein. This one is the posterior tibial vein. This is the peroneal vein, sorry. This one is the peroneal vein and this is the posterior tibial vein. So you can see the connection between the posterior tibial vein and great saphenous vein. That is the Boyd's perforator, which is otherwise called knee perforator, which is present just below the knee. So these points to be noted. Next about the lateral ankle perforator or leg perforator. So it is at the junction of middle of the lower third of the leg, where we see the short saphenous vein. So this one is the lateral ankle perforator. So where the connection is between the short saphenous vein and peroneal vein. This is the peroneal vein. So the connection between the short saphenous vein and the peroneal vein is the lateral ankle or the leg perforators. So these three perforators are very important to be noted. So that is 4th, 5th, 6th medial ankle perforators are also the lateral and there are also some 3 perforators which are considered as 4th, 5th and 6th perforators, because 3 we finished. So those 3 are here, okay, which are considered as medial ankle perforators or Cockett's perforators. So they are called as Cockett's perforators, and upper medial junction of the middle and the lower third of the leg they are present. and middle 4 centimeters above the medial malleolus they are present, and lower medial one is called posterior inferior to the medial malleolus, and posterior arch of vein, it connects the posterior arch vein, this is the posterior arch vein, and it connects with the posterior tibial vein. This is the posterior tibial vein, this is the posterior arch vein. So these two veins are connected by Cockett's perforators. Usually they are 3 in number. Medial ankle perforators. So this is the summary of superficial veins, deep veins, and important perforators as well. So let's do some MCQs associated with the saphenous vein. So true regarding saphenous vein, long saphenous vein formed by the continuation of medial side of dorsal venous arch, long saphenous vein situated posterior to the medial malleolus, long saphenous vein closely related to the saphenous nerve, and short saphenous vein open into the great saphenous vein, and short saphenous vein associated with the sural nerve. So which are the true regarding saphenous veins, whether it is long or short? So the answers are long saphenous vein is formed by the continuation of medial side of dorsal venous arch. A is the answer. I hope you all know that. And long saphenous vein, it is associated with the saphenous nerve, that is also correct. And short saphenous vein is associated with the sural nerve. Okay. And one thing to be noted, the long saphenous vein is related anterior to the medial malleolus, so not posterior. So that's the reason this statement is wrong. And short saphenous vein opens into popliteal vein. It doesn't open into the great saphenous vein. So that's why this statement is also wrong. The next question here it is, the direction of flow of venous blood in the condition of valve incompetence affecting the perforators of the lower limb is. So answers would be along the gravity, superficial to deep, along the osmotic gradient, deep to superficial. So the answer is deep to superficial. So this completes about the veins of lower limb, venous drainage of lower limb. Clinically, they are very important to know.